Well, I just want to thank you, Peter, for your warm welcome. And I also want to thank Dominique as well for energizing all of you so that you'll stay with me for another 20 minutes. Now, firstly, I will be looking at the best practices of how organizations use data. Secondly, looking at a case study that we have in the South Pacific Division of how we are starting to apply this. Big data has changed the way we manage, analyze, view, and leverage our data. Walmart. Everyone's heard of Walmart, right? Okay, so what we can see here is it's the biggest retailer. There's over 20,000 stores in 28 countries, and they have 2.5 petabytes of data every hour. How much is a petabyte? Well, it's 10 to the power of 15, or otherwise 1,000 terabytes. A lot of data. Significant resources are devoted to the development, maintenance, refining, and synchronization of its distribution and data networks. Walmart actually tracks everything you do. They look at all the purchases of all their customers over a two-year period. And they collect more data, they collect so much data that they actually are second to the US Department of Defense. But it's important to collect the right data and to use that data and monitor consumer behavior, develop predictive models and distribution models. A senior statistical analyst actually wrote, if you can't get insights until you've analyzed your sales for a week or a month, then you've lost sales within that time. If you can cut down that time from 2 to 3 weeks to 20 to 30 minutes, then that saves a lot of money for Walmart and stops us losing sales. That's the real value of what we have built with a data cafe. And they cite an example where they put a new line out. It went through all their stores, and what they found was that the sales started to go up. But in the afternoon, they realized that there were 2 stores that had no sales. They were able to contact those local stores and realize what the issue was, that they hadn't put the lines on the shelf. That's the power of data when we analyze data in this way. The king of streaming. Well, Netflix uses big data to drive their success. You know, in Q1 in 2019, they added 9.8 million subscribers. Now they have about 150 million subscribers, and they're expecting another 5 million by July this year. And this is actually translated to about 344 million in profit, up from 290 million the same time last year. Data mining and developing algorithms play a key role to Netflix customer retention strategy. And it's estimated that they save $1 billion a year in value. They know they've got about 60 to 90 seconds before they lose a customer. Now, how did they develop these algorithms? Well, in 2006, when they were predominantly a DVD mailing business, they launched a prize. And this was a $1 million prize to the group that could create the best algorithm on predicting what customers would like to watch next. In 2009, the winning entry was announced. Behavioral data analysis allows Netflix to create a better experience, a better customer experience. And this is done through analyzing the data, the ratings, the searches, the dates, what type of device you watch it on, what programs, when you pause your programs, when they get rewatched. They look at all of this information And by analyzing this data, they are able to make bold decisions. An example of this is when they looked at one of an award-winning director, the most popular one at that time, and they combined it with an actor who was an award-winning Oscar actor. And what they did was they looked at the fan bases of these groups of people, and they realized that if they were to invest in this next TV series, that maybe that they would actually get the next smash hit. And that's what happened. They invested $100 million on 26 episodes. They took their subscriber base from 33 million at the time to now being over 150 million, as I mentioned before. It was an instant success. Now, it's important for us to look at what other industries are doing as well. You can see here from this graph here that it's looking at the digital maturity of different industries. TMT, telecommunications, consumer, fast-moving consumer goods, they are further along when it comes to digital maturity. As compared to the healthcare area, most of my time was actually spent in the corporate world, in finance, and the amount we were looking at internet banking back in the 90s. And so we were further advanced in this area. But if we can take the trends from these other industries into the work that we do here at healthcare, we could actually have a competitive advantage. Look, the Amazon effect provides infinite selection. It recommends competitive prices, it's reliable, it's free. Many times they have specials and fast delivery. Living in Australia, I know when I buy something from Amazon, and I'm not getting paid for this, by the way, but I will actually get my parcel delivered earlier than expected. And that is the standard and the benchmark that they're setting. So when we are looking at benchmarking, are we looking at just in the healthcare industry, or are we looking at in the other industries that may be more advanced in some areas? The focus is customer centricity in a world driven by technology. Today, too many companies are trying to incrementally improve what they have. They don't go fast enough and they don't go far enough. Expectations spread to every industry. When we encounter a really good experience, we rely on that experience. That ends up being our standard. When we don't receive that experience, we get disappointed. And then with word of mouth, we can actually be quite damaging to that brand. This phenomenon is so widespread that it's now affecting, that what we do, what Amazon does can actually affect what we do and the customer service that we're delivering. The power of data also has had many positive effects in hospital settings, in the healthcare industry. We see reduced costs of treatments. We see that it's many different things. He predicts outbreaks of epidemics, facilitates decision-makings, monitors services, improves operations and efficiencies, and even helps us identify new opportunities for innovation. So what about Kaiser Permanente when we look at that? And when I was doing some research in this area, I saw that way back in 2013, the Kingsley and Company was actually put a report together, and it said this: the integrated system has improved outcomes in cardiovascular disease and achieved an estimated, how much? So I can't hear you. $1 billion in savings from reduced office visits and lab tests. That was back in 2013 with the help of their electronic health records, their business intelligence, etc. So look, we hear a lot about artificial intelligence. What are the projections over the coming years, and is this relevant to us? At hyperspeed, the artificial intelligence is rewiring our modern conception of healthcare delivery. AI in health represents a collective multiple technologies enabling machines to sense, comprehend, act, and learn so they can perform administrative and clinical healthcare functions. What we find here is that in 2014, it was predicted, as 2014, it was about $600 million. By 2021, we see 11 times growth is predicted to $6.6 billion. That's a compounded annual growth rate of 40%. Accenture predicts that key clinical health AI applications can potentially save $150 billion in annual savings, and this is just in the US alone. And this is for by 2026. How will this transform the way you work? How will this impact you, your patient's journey, people in the community? How will things be different? Will we be at the forefront or will we lag behind? Today I want to encourage our church to be at that forefront, to look at this seriously, because when the times are tough and it's hard to make margin, we need to make sure that we are on that competitive edge. What can we do now so that our life will be easier as we progress in time? Empowering people with analytics and artificial intelligence is where the real value occurs. That's where the real value creation happens. Simply having the best data or writing the most cutting-edge algorithms is not good enough. It's not going to make the difference. The difference will be when the organization adopts this, when there's organization transformation, when there is complete, robust change management that takes place. Not just buying a business intelligence system, not just having a customer relationship management system. It's when we actually train and educate and let the users have it at their fingertips to use and to monitor and look at trends and opportunities. So what I'll do now is just share with you an initiative that we're working on in the South Pacific Division under Adventist Health. We've created a brand called Elya Wellness, which means empowering lifestyle innovation advocates. This is something we're embarking on. We haven't finished. We're just starting. We've been working on this for the last couple of years, and we're excited about the potential that it can have. Elya Wellness captures data through many different interaction points, through the website, through mobile apps, through wearables, also through different programs, initiatives, and partner engagement as well. We are driving holistic health. This is what we're wanting to do. It's no more just an event. It's not just one course that you're doing. What we're wanting to do is having a journey that takes people from one aspect to another aspect to improve their whole person health. So we've got here the 7 dimensions of wellness: the physically energized, the socially connected, being vocationally enriched, spiritually empowered, intellectually engaged, which is about the cognitive. This is about having a mindset of learning, and environmentally attuned, which is our impact on the environment and its impact on us, as well as being in terms of emotionally thriving, being at our best emotionally and being emotionally aware. This is really important when we look, we've also developed an assessment, but it's important for us to see where people are at so we can see how we can help them. With the whole goal of setting up a wellness journey and pathway. Lifestyle research is going to be a key focus area for us. We've got the Lifestyle Medicine Institute with Sanitarium. We have the Lifestyle Research Centre with Avondale. We've got the Australasian Research Institute with our Sydney Adventist Hospital. And we're going to be starting to work more closely together so we can play to our strengths. We're wanting to develop a trust economy Trust is the number one factor in engaging the communities. And we want to work with our health professionals, our churches, our institutions with an overarching strategy, which is the comprehensive health strategy. And this is really important because if we want to be leaders in this space, we need to really work with our institutions because they have the credibility and they have the skills and the expertise as well. And that's why trust is so important for us to create and to uphold. Because when we are trusted, we can then create the news through the insights we gain from the data and the research that we have. This data also enables Elya to move into an arena we have not been before, using emerging technologies like machine learning to amplify our research and insights into wellness. Machine learning is the ability to automate data analysis to build comprehensive health models for cause and effect. And this is crucial. It helps us to discover things that we may not even know to even ask. It provides us with those cutting-edge insights. It is through these insights that we can develop value for the community, for professionals, for pastors, for members, and for the Gospel Commission. We are moving from an era of manufacturing to an era of value-facturing, where identifying and providing niche value is critical to the engagement of an individual. It allows us to cut through the greatest needs, and it helps us to identify missed opportunities as well. Now, this is where I get really excited when I look at the local needs and look at how we can make this relevant to the local church, to our community, and to our churches. Take for an example here. We will be doing corporate programs, corporate marketing through Elya Wellness. And this will then allow us to reach a lot of people in the community. We'll be able to run My Wellness Snapshot, which is our new Health Expo tool, through a local church. They will also get contacts. And then there'll be people doing Elya Talks, which is our new health seminars that we're developing as well. Clinics will be able to run their own initiatives. And as we do this, we start building up our contacts within the area. But how do we do this in a really efficient manner? How do we actually focus and provide the needs? Today, when you are actually developing your programs, what data do you use to help you identify the needs and ensure that what you're delivering, your value, is actually meeting those needs? What we're going to embark on now is that we will be able to plot and look at these two different circles, and you can see that one shows a high opportunity, one shows a low opportunity. Then we will be able to drill down to the demographics and look at, female and male, age groups, and then drill down further to the 7 dimensions of wellness map to see what the needs are of those people. We have over 100 questions in this assessment that we do, which is mainly made up of validated indexes. But this will allow us to then plot where the current activities are around, what are the current churches that are involved, what are the current cafes and clinics and health professionals that are involved in those areas, and look where the new opportunities are. By bringing all these points together brings us to an important point. Data shows us opportunities we can't see, and data also shows us where we can actually target people who are actually spiritually receptive. This eliminates the guesswork. It provides a high return on investment. We go from planning to strategic thinking, and it helps our missions, our conferences, our hospitals, our organizations to allocate our resources more effectively. The whole goal here is to help people with one need, journey together and build relationships. And as we do that, build trust, be emotionally connected with the individuals, spiritually receptive, when the Holy Spirit touches their heart and lead them on a holistic lifestyle journey, both here and on earth and eternally. And our strategy is based on John 10:10. Say it with me. I have come that they may have, and that they may have it more abundantly. How many of you have heard of Elderman's Trust Barometer? Okay, nobody in this room. So they have a global annual survey that measures trust. And it's done annually on media, organizations, businesses, and mass populations. In 2019, healthcare data showed that there was 11 percentage points higher trust in the credibility of health companies than general media reporting on healthcare. Well, this gives us an opportunity. And our goal here is to be the go-to place for lifestyle medicine, for whole, holistic lifestyle initiatives, where we are trusted because the information we provide is evidence-based, and it also is aligned with our Adventist Health philosophy. So, just wanted to end on that note there, but I will go back to one slide there, sorry. This is one point I wanted to bring out. It's interesting that they say to rebuild trust and restore faith in the systems, institutions must step outside of their traditional roles and work towards a new, integrated operating model that puts people and addressing of their fears and needs at the center of everything they do. And I believe, and we believe, that our church can play a significant role in this. Thank you.